everyone, and welcome to the Annual Medicare for All Strategy Conference for 2024. This year, our theme is Healthcare Beyond the Ballot, and we are so excited to have you here. I am Jillian Mason. I am the Interim Executive Director of Healthcare Now, and here I have my colleague, Jerry.
I'm Jerry Katz. I serve on the Healthcare Now board, coming to you from Minneapolis, Minnesota.
And Jerry is our conference coordinator. So thank you so much, Jerry, for all the amazing work that you've already put into making this conference a success. I also want to thank our amazing sponsors for this conference. We couldn't do it without you. We have National Nurses United fighting every day for nurses' rights in the workplace and for Medicare for all of us, Physicians for a National Health Program, these doctors who are not just healing their patients, but trying to heal America's health system. We've got the labor campaign for single payer, fighting unions, looking to make sure that all of us have the healthcare justice we deserve. Our good friends at People's Action, bringing the fight to the streets. Progressive Democrats of America, laying the groundwork for all the fights that we have coming up. One payer states fighting for Medicare for all on the state level, and New Jersey Healthcare Coalition, Universal Healthcare Coalition. Shout out to New Jersey from a proud Jersey girl. And last but not least, Russ Rubicki, who is a socially and environmentally responsible investor, who has a socially and environmentally responsible investing company, and he's also a sponsor of this conference. We also want to thank all of the individual and organizational members of Healthcare Now, whose contributions allow us to continue to build the movement for healthcare justice through organizing and education. And if you'd like to become a member by donating any amount to our work, you can always visit healthcare-now.org. So we're going to be, we'll have an opening plenary over the weekend, and we'll be able to, really get excited together then. But Jerry and I just wanted to reach you, say welcome, and to tell you a little bit about the program for the coming week. So shall we?
Yes, we'll start by talking about the conference program. We want to give you a few tips and tricks for getting the most out of this virtual conference. We've put it together with a great combination of pre-recorded and live presentations that cover a whole range of topics that are important to the movement for healthcare justice. So first, let's walk through the pre-recorded content. We'll release more recorded content at 5 p.m. Central every day, leading up to the live conference on Saturday, June 1st. So check back throughout the week. There's going to be new stuff every day. You can register for as many of these pre-recorded sessions as you want and watch them at your convenience. So make sure to go to the schedule and sign up for anything that interests you. So first, on Tuesday, May 28th, we'll release a welcome from United States Representative Pramila Jayapal of Washington State, and she is the author of the House Medicare for All bill and a champion for our movement. We will also have greetings from United States Senator Ed Markey of Massachusetts, who's the chair of the Health, Education, Labor, and Pensions Committee, the HELP Committee, and he is a longtime fighter for Medicare for All. And most recently, he introduced the state-based Universal Health Care Act. And then finally, we'll have a presentation called Care Over Cost. We're fighting United Health and winning, from People's Action senior strategist Ryan Greenwood, and he's going to fill us in on their occupation of the United Healthcare headquarters earlier this year.
So exciting.
On Wednesday, yes, very exciting. Happened right here in the great state of Minnesota too. We're very proud. On Wednesday, May 29th, we'll focus on the work happening at the state level with a presentation called MFA and Campaign Reports from the States, What's Happening in Maine, New York, Oregon, and Washington from our friends at One Payer States. We will hear an update on CalCare from Max Cotterill, the M4A organizer for National Nurses United, and we'll have an update on the state-based Universal Health Care Act, a pathway to national M4A plus from Chuck Pinocchio and One Payer States. Then on Thursday, May 30th, we'll talk about the ongoing insidious push to privatize public healthcare systems we do have, starting with James Waters from Students for a National Health Program and his presentation on Medicare Advantage, Who Pays the Price. Rose Roach from the Labor Campaign for Single Payer will present the naked profiteering that's destroying our healthcare system. And finally, Suzanne Gordon, journalist and author and founder of Veterans Healthcare Policy Institute, will present why we should fight for VA for all and against VA privatization. And on Friday, May 31st, we'll get a special preview of a very special episode of the Medicare for All podcast, which I hope you all are subscribed to. You'll join hosts Jillian and Ben Day for The View from Capitol Hill with some of our favorite policy guys, Egan Kemp of Public Citizen and Alex Lawson of Social Security Works. That is our pre-recorded lineup.
Amazing. So you might be thinking, that's a lot already. And it is. But just remember, like Jerry said, you are able to watch those things on your own time, and they'll stay up on our YouTube channel after the conference, just in case you don't get a chance to watch them this week. So all of this leads up to the big day, Saturday, June 1st, and that is going to be the live day of our conference when we're all going to have an opportunity to actually get together, learn together, and build some community. So on Saturday, June 1st, we're going to begin at noon Central Time with live programming. I want to make sure that you note the time zone. Jerry and I are both coming to you from the mighty Central Time Zone, but you should make sure to adjust the time for wherever you are on the planet so that you can be there on time. The beginning then is going to be at noon Central. That's 10 a.m. Pacific, 11 a.m. Mountain, and 1 p.m. Eastern. We're going to begin with a plenary session. Like I said, we'll get excited together. We'll do a little bit of work together, thinking about the future of our movement over the next year or so. We'll follow that with some time for lunch, networking, and a special breakout room for participants who want to record their healthcare stories for our Voices of U.S. Healthcare project. Our first workshop block is going to begin at 2 p.m. Central with 7 options. We have Radical Visioning, a healthcare justice-centered America, how to best launch effective and winning strategies with Chuck Bonacchio from One Payer States. We have the 2024 National Healthcare Survey. This is a really exciting project by National Nurses United, and it's a way to show support for Medicare for All this election cycle. We have Bring the Fight to Them, how to plan a direct action with Robel Worku from People's Action. And we have integrating privatization work into Medicare for All advocacy with Ed Weisbart from Physicians for a National Health Plan. That's a great place to go if you want to think about how we're connecting some of this anti-privatization work, saving Medicare and Medicaid, to our larger cause of Medicare for All. One-on-one conversations for healthcare organizing with our very own Jerry Katz and myself. And we'll be talking about those important one-to-one conversations that help to build a movement over time. We'll also have a workshop on patients over profits. Take the corporate healthcare industry head on. That's, again, a great campaign from National Nurses United, us at Healthcare Now, and People's Action, and many more, where we're holding elected officials accountable to not taking money from the toxic healthcare industry. And finally, there'll be a workshop called Storytelling and Power Building, using our healthcare narratives to enact progressive policy with Vinay Krishnan of the Center for Popular Democracy. And that's going to be all about how to track politicians down and confront them with the stories of our own lives that demonstrate the moral need for Medicare for All. After that first block of workshops, right, we're going to take a quick break, and we'll come back at 3:30 p.m. Central for the second block, which will feature most of the workshops from the first block, as well as a new one that's really, really great. There's a presentation called Social Media 101 and Messaging for Organizing with this incredible digital organizing expert, Janae Noss, with infinite experience in this field, and can really help to crack the code of social media organizing for those of you who are interested in either sharpening your skills or maybe learning some things that you haven't learned before. Finally, at 5 p.m. Central, we are going to be coming together for a closing plenary. And again, just trying to get excited about what we have coming up after the conference. So at the top of the conference page, you're going to see contact information for Pavan. He's the leader of our tech support team, and you can always reach out to him or to conference@healthcare-now.org if you're having trouble registering or attending any of the sessions. We cannot wait to see you in the plenaries and workshops on Saturday. And if there is anything you need in the meantime, please, again, reach out to conference at healthcare-now. We are really fired up to see you and get excited together at the conference.
See you soon.